Tuberculosis is a notorious disease because it can affect any organ of the body. Friends, I mean it. It affects almost all the organ of the body. And obviously it doesn't spare bone and joint also. Friends, today I'll tell you the signs and symptoms of spinal tuberculosis. Let's start, friends. Hello friends. Spinal tuberculosis is the most common skeletal involvement of tuberculosis. Other joints like knee joint, hip joints and other small joints also can be affected by tuberculosis, but spinal tuberculosis is the most common in skeletal involvement. And usually this spinal tuberculosis is seen in patients below 30 years of age, and it is very common disease in child and adolescent. Patient can have constitutional symptom of tuberculosis like fever, loss of weight, loss of appetite, and evening rise of temperature, generalized weakness, anemia. These signs and symptoms are common in almost all the tuberculosis. But some specific symptoms of spinal tuberculosis. If a child is affected by spinal tuberculosis, he may not complain anything, but patient will deny, patient will not be willing to play, and he will not be playful like before. He will be restricting his movement, jumping and moving around will be very much restricted. And sometimes there can be muscle spasm, and because of that muscle spasm, patient will again be restricted from movement, and the parents will be complaining that my child is not playing like before, and he's not willing for any outdoor activities. And in advanced stages and in later stages, patient may complain of some pain, some localized pain like in the back or in the legs. And in more advanced stages, patient can have kyphosis. The normal spinal curve will be lost because of vertebral involvement and destruction of vertebral body. There will be loss of spinal curve. The normal spinal lordosis will be lost, and patient will be having kyphosis. And some patient can have thoracic cage abnormality and gibbous. Now come to cold abscess. Cold abscess is a typical feature of tuberculosis. Any other disease, there will not be cold abscess. The typical feature of abscess will be there, but in tuberculosis the abscess will be cold. So this cold abscess can be anywhere in the body, like it can be retropharyngeal abscess, it can be mediastinal abscess, it can be psoas abscess, it can be in the groin or inguinal area, in the back, in any other places. If the abscess is in the retropharyngeal area, patient might complain of dysphagia, dyspnea and hoarseness of voice. And if the abscess is in the mediastinum, then also patient can complain of dysphagia. Psoas abscess will give rise to difficulty in movement and problems in the legs, in the lower limbs. And now the most important symptom, that is paraplegia, or in general term we call as paralysis. Many patients come to doctor only with this complaint. Patient will come and will tell that I cannot walk. And other symptoms like I have already described might not be there. In this type of patient, this paraplegia will progress gradually. In the earlier stage, patient will not be aware of that paraplegia or paralysis. Actually, how this paralysis occurs, I'll tell you. Normally, the nerves supplying the body will come from the brain, and it will enter the spinal cord and it will go to the periphery. Now, the spinal cord lies in the middle of the vertebra, in the spinal column. Now, when tuberculosis will affect the spine, there will be destruction of vertebra or there will be problems in the spine. Then this spinal cord and the nerves in the spinal cord, it will be compressed, it will be affected. So there will be lots of neurological symptoms. Patient may have general weakness in the lower limbs. Patient may have sensory deficit also. In the earlier stage, patient will not be aware of the neurological involvement, and he will be quite okay, and he will not have any problems, any complaints. But on examination, doctor will find clonus or extensional plantar signs. Gradually this paraplegia will be evolved, or it will progress. So in next stage, in later stage, patient will complain of weakness of the lower limb, but he can move, and he will not be bedridden. And in more advanced stage, patient will be bedridden, he will not be able to move, he will be having neurological symptoms like paralysis and sensory deficit and loss of sphincter control. That means patient will not be having control over the bladder, and the urination of patient, it will be automatic, patient cannot control it. Friends, I have already told you all the symptoms of spinal tuberculosis in short. Spinal tuberculosis is important because its diagnosis and treatment, early diagnosis and early treatment is very necessary. Because in case of pulmonary tuberculosis, what happens is patient will be having cough for a long time, fever, and sometimes hemoptysis also. And with these symptoms, patient usually come to doctor very early. So early diagnosis and treatment will be very easy for doctor, and pulmonary tuberculosis will be treated mostly with 6 months treatment, so it is very easily treatable. But in case of spinal tuberculosis, in the beginning, in the early stage, patient is totally unaware of his problem. Actually, he doesn't know at all. So usually late presentation to doctor and late diagnosis is very common, and because of late presentation and late diagnosis, the complication of spinal tuberculosis and paralysis is also common. Any symptom related to back, any symptom related to weakness of lower limb, we have to take it seriously and get examined, get investigated, and get treated. Hope you have liked this video. If you have liked this video, please click the like button and subscribe my channel. Thank you for watching this video. Stay healthy.